We are going to talk a little bit today about how to be an extraordinary caregiver. Now, I suggested a couple other names for this that were rejected by the board. Well, mostly by the board president. I suggested "How Not to Kill Your Transplant Recipient." I thought that was a pretty good title. And then she suggested one too. She suggested "How Not to Get Killed by Your Transplant Recipient." She thought that was a much better title. So we'll just go ahead and go with how to be an extraordinary caregiver. So these are kind of my I usually put my titles in whenever I do my slides, and I put this as husband, caregiver, nurse, way down at the bottom, and then survivor, because we survived this. Both Jenny and I did. So my first question I'm going to have for you guys, and you can either put it in the chat or you can chime in if you want to unmute and chime in. But what is your definition of a caregiver? What do you think of when you think of caregivers? You can either put it in the chat or you can put it in, or you can unmute and say a little something if you'd like.
I think of that as like your support system. Like the one that kind of like your ride or die, the one that's with you through the whole
100%. Absolutely. Mm-hmm. Absolutely. What else? Anyone else?
I always saw you, Kevin, as my go-to person if I didn't know what was happening. Mostly because you're a nurse, but like if I didn't understand something, I would ask you, what does that mean? And I think that probably is with a lot of other regular people, not nurses, how if they don't understand something, maybe their caregiver does.
It's kind of nice to have, we got lucky having healthcare workers in the family. It's kind of nice to have someone in the family who has a little bit more professional knowledge of what might be going on. But for those who don't have it, you can still count on your caregivers. And what I find is oftentimes the caregivers will do a lot of research and sometimes know more about the disease and the process and everything else than sometimes the healthcare providers, because they're really hyper focused on whatever that one thing may be. In the chat, Amy put someone who loves, supports, and cares for you. And I think that's a great definition of caregiver as well. So we'll kind of talk a little bit more about what a caregiver is and what are some of the roles that we end up providing as a caregiver. As a caregiver, you may end up providing a bunch of different roles. You may end up being you may end up doing physical care and actually doing physical care with your transplant recipient. Emotional care is a big part of what we do when someone has gone through transplant. Sometimes you're going to be the one kind of tracking their progress and keeping a close eye on them. You may be their transportation. And one of the things that I think is probably one of the most important things to do, whether you're a nurse or whether you're just a caring family member, is that advocating for your transplant recipient. Always never be afraid to not be their voice. If there's ever kind of questions you have, or maybe you see that they have a question that maybe they're not asking for whatever reason, I think it's an important role for us to be advocates for our transplant recipients that we love and care for. Now, one thing to tell you for sure is that caregiving is not for the weak. It can affect your mental health, your emotional health, your physical well-being. You have risk for isolation as a caregiver. You can end up having stress or even depression or anxiety. Because sometimes as caregivers, we get so wrapped up in what we're doing that we kind of forget about everything else when we're really kind of hyper focused on that one person that we're caring for. So it's something that we got to be careful of as caregivers, and we'll talk a little bit about how to help fight that. And oftentimes we don't give themselves the opportunity to process their own feelings. We get so busy caring for others that we forget that we end up having an emotional roller coaster with this transplant journey as well. So it's really important that as caregivers that we give ourselves a chance to process our own feelings and talk about what we are going through, both secondhand from the transplant recipient, but also as what we go through as a caregiver. And we'll talk a little bit more about that. And oftentimes caregivers do this, whether it's transplant related or not. And if you have children, you probably already know this, but oftentimes we neglect our own needs to focus on the needs of the person that we're caring for. And while that, is okay in small doses, it's important that we take care of ourselves too. It's like the old adage they say when when they joke around about they talk about in the airlines, they say, put your mask on first so you can help others. And same thing with caregiving. We got to take care of ourselves so we can be better caregivers for the people we're looking after. Now, one thing I want to just spend just a little bit of time talking about is what to expect before, during, and after surgery. And we're going to talk about the pre and the post transplant journey. And keep in mind, for the transplant recipients, life might look completely different pre to post transplant. Pre-transplant, depending on how sick they are, their life can look completely different. When Jenny was going through transplant, just before her transplant, she got to the point where she had a pretty hard time breathing. She wasn't really breathing really well. I remember, she was on a lot of oxygen. And it was hard for her to do things. She didn't have the energy and stamina that she wanted to do the things she wanted to do. And all that changes, hopefully, at the time of the transplant. And now each transplant journey is different. And depending on what organ you have transplanted and your health and everything else, it can go a lot of different ways. But oftentimes that journey from pre to post-transplant, your life can look very different. And that's something to be ready for, because that's going to cause emotions, even when it's good change, that much change will cause emotions in everybody involved. So that's for the recipient, and everybody who loves that person is all going to go through a little bit of something. So it's important to remember that life's going to look completely different. Oftentimes it looks a lot better. And that's the kind of cool thing about transplant. Pre-transplant, as caregivers, one of the things that we're often doing as caregivers is sometimes we have to accompany our transplant recipient to appointments. We'll be going back and forth to appointments, getting them to the hospital, being there with them when they meet with the doctors and the different specialists. And I remember all the things building up to Jenny's acceptance on the transplant list. She went through a battery of tests that required, sometimes it required that she had a person there to be with her in case she had to do like anything that included sedation or anything. Or sometimes she just needed a ride getting back and forth to the hospital. But accompanying your transplant patient to those appointments is a big part of caregiving. You end up putting a lot of time in to this disease process as well. Getting a chance to ask the doctors to explain the treatment choices, test results, and medicines as needed. Oftentimes we don't know if we don't know what the doctor is talking about. One of the most important things we tell people to do, and this is me putting on my healthcare worker hat, is oftentimes we tell people, if you don't understand, then you got to have that conversation with the doctor, find out exactly what's going on, and ask those questions and clarify till they tell you in a way that you can understand. It's really, really important with the transplant patient, with the transplant recipient, because it's such a big transition, and so many things go into it. One of the things that I've seen many caregivers do is keep track of things in a notebook, and have a little notebook. Oftentimes I'll see patients come into the hospital and their caregivers have a notebook of everything that's gone on with those patients. And I love that. Because then I can say, as a nurse, I can say, well, how did things change from yesterday to today that brought you here now to the hospital? And they can look back in the notebook and they know exactly the vital signs from yesterday. They know how much sleep, how much they ate. And some caregivers keep very detailed notes. And that's a great way to help kind of make sure you're keeping track of progress and know exactly what's going on with that person. One of the things you need to do pre-transplant, and when you start that transplant journey, is with your loved ones who are going through it, you got to have the understanding of what are the treatment goals and what is a realistic expectation of what to expect post-transplant. I mean, have a realistic picture of what exactly that's going to look like. And that's one of the critical things you need to do prior to ending up on the transplant list and getting transplanted. Now, let's talk just briefly about transplant day. I'll never forget the day that we got the phone call. We had an appointment about 24 hours before Jenny got the phone call. We had an appointment with her transplant team, and her transplant team, I'll never forget, her coordinator said at the time, he said, I just have this feeling that this is going to happen fast. And I remember asking, like, what's fast? Like, what does that mean? And he goes, I wouldn't be surprised if in the next month or so, we're doing something. Could be a month, could be weeks, could be, anything, could be much longer. And I remember leaving that appointment with Jenny and going, wow, we got to get our poop in a group, man. We got to get everything ready and figure out what the plan's going to be. And I remember we said that we're going to sit down and we're going to have a conversation with her mom and her grandma, people who are going to be part of her support system, and have a conversation of what exactly that's going to look like on transplant day. And I remember leaving that appointment saying, gosh, we got to really kind of sit down and kind of plan this out and talk about it because now it's getting real. 12 hours later, 12 hours from the time we had that appointment that I went with Jenny to that appointment, 12 hours later, she got the phone call. And I'll never forget, I was up getting ready for work and the phone rang and I heard her talking on the phone, and I came down the stairs and I was like, what was that? And she's like, I just got the call. And I'm like, what call? And she's like, the call. And she was frantic. She was running around frantic. And I was just standing there, just sitting there holding my head like this. And if you, I don't know if you can see my picture up there in the video, hopefully you can. I was just sitting there holding my head going, oh my gosh, like this is now, we're doing this now. And we were told, yep, get to the hospital, get there as quickly as you can. We got a lot to do. So sure enough, we packed up and got ready and went down to the hospital. And I'll never forget just the overwhelm of, well, shoot, we wanted it to happen fast, but we didn't think it was going to happen now. That day was kind of a blur. But I remember conversations going down, going, she was like, okay, we got to talk about this bill. She was more worried about how I was going to be doing and how everything was going to go for me. And I'm more worried about how this transplant's going to go. So it was really an emotional roller coaster of a day. I'll never forget that day as long as I live. But my goal there was to be, supportive and be encouraging and be like, this is going to go great. This is going to go awesome. Because even though we both had anxiety in our head, you got to always try to kind of remember to stay positive. And one of the things I always tell people is expect a lot of waiting. I honestly don't even know how long we were there. I remember we got to the hospital probably about 6 a.m., between 5 and 6 a.m. And I remember leaving well after midnight and going home and getting just a little bit of sleep. And by that time she was done. And I just remember that whole day just being a blur. So expect a lot of waiting, bring stuff to do, keep yourself busy, because it's going to be a long day in the waiting room, and be ready to provide updates to friends and family. Because if, friends and family always know when things like this are happening, and certainly we let folks know via social media, and everyone got to kind of keep up with us and join the anxiety roller coaster with us. So it's a long day, but it's one of those days that like your energy is going to be super high. Now, one of the things that you got to talk about is you got to keep in mind that as much as we think of transplant as being such a great and wonderful thing, is they don't always go well. So you got to have those worst case scenario conversations. Transplant success is not always a guarantee. Sometimes they go really wrong. And one of the things that I remember very specifically when we got to the hospital is the doctors very clearly tell you this is a no until it's a yes. So they said, we get the lungs here. We take a look at the lungs. They say the lungs don't look good. They open up the person and say, oh gosh, something's wrong with these lungs. Then it very well may be a no. And until we're actually going into surgery and getting started, there's the possibility that this could all be what they call a dry run, that we go all through that and then we're like, sorry, this isn't going to work out. And let me know in the chat if anyone is post-transplant and had been through a dry run. Let me know. I'm curious to see. That was kind of my biggest fear, is that we were going to get there and then, she was going to wake up a few hours later and be like, yeah, that didn't really work out. So you got to kind of plan for the worst case scenario and have those conversations and talk about what exactly that's going to look like and what does that mean, and be ready for that less than optimal outcome. We always say kind of prepare for the worst, but hope for the best. And like I said, we got lucky and everything went amazing. You got to have those hard conversations, like things like advanced directives. Like, would they want to be resuscitated? Do they want CPR? Do have you thought about what would happen if maybe it didn't go, maybe if it went horrifically bad? Those are uncomfortable conversations to have, but they're important conversations to have, because you need to have had those conversations by the time you get there. So what are their wishes? What are your wishes? And where do you guys fall in all that stuff? What happens if it doesn't go well? So hard conversations to have, but really, really important. Now, everything goes well. You get through the transplant, things go well, and now starts a very long journey. So, we had this very long day of the transplant day. And the next day, we knew that this was going to start the very long journey of recovery. And, the transplant facilities usually do a pretty good job of kind of preparing you for worst case scenario. They say, well, she could be in the hospital for months. They could be in the hospital for a very long time, depending on what you're getting transplanted. It could be very short or it could be very long, and everything in between. We were lucky in that Jenny's recovery went incredibly well. But during that recovery time, the recovery time is going to be variable based on what you got transplanted, your health. There's a lot of factors that go into that. And in that post-transplant phase, you may end up as a caregiver be serving a lot of roles. You may be a nurse, you may be a driver, a therapist, being the one that they get to vent to, a cheerleader, an errand runner, a personal chef. Thank God I didn't have to do that too much for Jenny, because otherwise she'd have a whole other host of health problems. But you really may end up playing a lot of different roles. And even for someone who doesn't have healthcare experience, you may be, playing nurse and doing dressing changes and making sure that, things are kept clean, and, the drains and chest tubes and all those types of things. So you may end up serving a lot of roles as a caregiver, and it's important to know that kind of going in. A lot of times, it was scheduling and driving from doctor's appointments. When Jenny had her transplant, that I don't even remember how long it was that she couldn't drive for. There's like a period of time that she wasn't allowed to drive a car. And we knew that we had to plan for what that's going to look like. She's going to need a ride to different places. Advocating for your loved one, whether they're there and able to advocate for themselves or not. It's important to always be an advocate for your loved one. Keeping your patients, keeping your loved ones on a strict medication schedule. One of the hardest things with transplant is all the medications that you got to take. Now, hopefully by the time, usually with their health deteriorating, you're kind of used to that already. But it's a big change. Aiding with just everyday tasks, things that they may not be able to physically do themselves. When Jenny first got done with her transplant, we had a separate part of the house that was upstairs. And, for the first couple of days, she wasn't able to go upstairs. So she needed something upstairs. I needed to go bouncing up there and take care of what she needed. And then one of the things I always say is you got to encourage exercise and wellness, and encourage the best you can. This picture here that you're seeing is me doing exactly that. So Jenny was doing laps around the hospital. They make you start walking almost immediately with a lung transplant. And she was encouraged to walk around the floor, and she was using the wheelchair as a walker there to carry her chest tube. And then I decided that she needed a little extra challenge, and she should go ahead and push me in the wheelchair too. So This was just me trying to be helpful. This wasn't me being lazy at all. Well, maybe just a little. One of my favorite post-transplant memories was when Jenny had just kind of waken up. You see a picture of that here. She had tubes everywhere, lines everywhere, as you can see there. And I'll never forget, she had that nasal cannula in her nose. And she looks at me like, why do I still have oxygen on? And I was like, I'm not sure. And she's like, well, what's my SAT? And she couldn't see the monitor. And I could see that her SAT, as you see here, was 100%. And she was like, wow, that's pretty good. And what she didn't know is she did have the nasal cannula on, but it wasn't, there's no oxygen flow to it. It was turned off. They just hadn't bothered to take it out of her nose yet. But that was the first time she had been satting 100%, I don't know, probably in her life, probably at least not in a really long time. And that was a pretty exciting feeling to go through and say, holy cow, you're satting 100%. You don't need that oxygen anymore. When just 12 hours earlier, 24 hours earlier, I think she was on like 6 liters of oxygen, which is a lot. And if she was on less, she'd be really short of breath. So that's kind of one of my favorite post-transplant memories. Now, as a caregiver, you're going to find that there's not always enough time in the day to get everything you need to do done. And that's something that becomes a little bit of a balance, is looking for the balance of caring for your loved one. Oftentimes the caregivers still have to work. They may have children to look after. They may have, cleaning, shopping, exercising to do, cooking to do, whatever the case may be. And one of the things to always make time for is make sure that you're adding a little time for self-care and taking care of yourself as the caregiver. Because we tend to kind of forget about that piece and get so focused on our transplant recipient that we forget sometimes to take care of ourselves. And we'll talk more about that. And that's a good time to kind of ask for help from your family and friends. That's when you can start kind of encouraging that team to come in and help you take care of your loved one. Now, one thing Jenny asked me to mention this is, don't assume that your recipient needs you 24/7. Don't be like the hovering, I'm always right here kind of caregiver. Sometimes what they need is, to start kind of gaining that independence again pretty quickly. So you need to have a real honest conversation with your recipient and say, what do you need help with? What do you not need help with? Where do you want me to give you a little bit of leeway? And having those conversations in advance makes it a whole lot easier to then maybe not jump up and try to do something the minute they try to, you look like they're going to try to get up off the couch, for instance. Find out what they need your help with, what they want your help with, and try to establish some boundaries the best way you can. The nice thing is it will help regain their independence, and also helps, keeps it from causing you unnecessary stress and unnecessary work. Now, one of the things that's really important to know as a caregiver is when to call for help. When do you need to defer to a professional? And with these, some of these things are kind of more on the lung side, because that's my experience. But understand that your organ may be different. Your signs and symptoms of, badness might be different depending on what organ you had transplanted. So, but things that are kind of general are things like fevers. If a post-transplant patient is spiking fevers, that's probably a bad sign for everybody. Excessive vomiting or diarrhea, high or low blood pressure is something. I remember when Jenny got out, she had to take her blood pressure very regularly for a little while. And they watched it very closely. She kept a very close log of it. If they have headaches that aren't relieved by Tylenol, if they're having swelling, look at the swelling on her feet. Holy cow, her feet look like little sausages. These little piggies went to the market and got full. There's lots of swelling. If there's swelling, fluid retention, those in general are probably bad for most transplant patients. So those are kind of general things. But one of the things that's really important is and this is either post-transplant, immediately post-transplant, or just in general, the expert at their health is your transplant recipient. if they tell you something's wrong, if they tell you that something's off, if they feel a little bit off, believe it when they say that, and take that seriously, because sometimes they'll feel like things are just a little bit off. I'll never forget when Jenny was pretty close post-transplant. She didn't feel too good one night, and it was kind of the evening, and she was like, I don't really feel too good. And she kind of was like almost spiking a fever. And 12 hours later, we ended up in the emergency department because she was sick, and starting to become septic. And luckily they were able to jump on it and take care of it quickly. But when they say something feels a little bit off, take that real seriously. Now, let's talk a little bit about medications. My transplant recipients who are on this call know that there are a bunch of medications that you're going to have to take for the rest of your life. You need to know, for the caregivers, you need to know what medications that your recipient's taking. They may need reminders. They may need a little reminder like, oh, it's 9 o'clock. You got to take your meds. Don't forget to take your meds before you go. Or hey, we're going to go out. Take your meds with you. Those kinds of things. The average recipient, transplant recipient, takes anywhere from 10 to 20 different medications daily. That's a lot for anyone to remember. So being a caregiver, one of the things that you can do that'd be really helpful is to remind them of what exactly they need to, their medications. And the nice thing is, if they're ever in the hospital, you have a list. I always kept a little list. I kept a little list on my phone where I could zoom in on it. And I had a list of all Jenny's transplant medications. Now, keep in mind, those dosages, the frequency, all those things change very, very frequently at the beginning of the transplant journey. So you need to make sure you have a good idea on all those things. Hold on one second. I'm getting a note here. Jenny just dropped a note during this section, and she said that to make sure that the caregivers are helping fill the medication, pill bottles. We don't have time for that. That's a whole different story. I tried to avoid that as much as I could, because watching her fill her pill things each week is still a journey. So if you want to be a good caregiver, and not just a good caregiver, but an extraordinary caregiver, then you should sometimes help, unless you're Kevin, and then you shouldn't. So some advice for caregivers: don't be afraid to take breaks. Sometimes you need a little break too. You got to take care of yourself. Caregiving can be exhausting, and especially when it's 24/7. Full-time caregivers really, really work hard. They need to take breaks. They need to rest and recharge too. And keep in mind that the caregiver needs a support system too. And sometimes what you just need to do is just ask for a little bit of help. Keep in mind that your recipient is the expert on their health. So make sure when they tell you something's wrong, believe them in that, and ask them how best you can help care for them. It's an important thing to do. We'll talk a little bit more and a little bit about the buddy program, because this is a great way to get that support that you need as a caregiver as well. Now, for every caregiver, nobody can do this alone. You as a lone caregiver, you're going to be tired. It can be an exhausting process. You need to build a team. You need to build a team of folks who can help you with your recipient. That could be spouses, parents, children, friends, and family. Enlist help. There's a lot of people who love your recipients and want to be a part of that and would be willing to help out. And all they need to do is be asked. Now, I say that, the title of this is How to Be an Extraordinary Caregiver. And I don't hold a candle to these people here in the picture who had been caring for Jenny her whole life. Her mom, amazing caregiver. This is who should probably be giving this talk. Her mom is an RT. If you didn't know, her mom's an RT and had been caring for Jenny her whole life and done an amazing job. Her grandma, oh my gosh, her grandma had been caring for Jenny since she was just a little baby. So big shout out to them. They are the extraordinary caregivers. Now, keep in mind that this whole caregiving thing might take some adjustments. it's a critical role to the health and well-being of your transplant recipient, that they need a care team and they need people to look after them. And understand it can be stressful for you. It could be stressful for them. And sometimes the roles are reversed. Sometimes the person who gets the transplant is the one who's usually the caregiver, usually the one taking care of folks. And suddenly they now have a health challenge that's going to make them need to be the one to ask for help from others. And sometimes that's a little bit of an adjustment for folks. That's one of the hardest things for them to the recipients to sometimes do, is realize that they are going to need some help. So major health events come with a certain loss of control. You're not going to be able to control everything. Everything changes post-transplant, as you guys know, everything changes. You have medications that you got to take every day. You have, certain things you can eat, now you can't eat. Certain things that you have to do every day to maintain your optimal health. That can be pretty overwhelming for the recipients, but for the caregivers as well. So just kind of keep that in mind, that it's a tough transition for everybody. There may be some feelings from the recipient and the caregiver may experience. They may experience fear, excitement, guilt. Guilt is something that oftentimes recipients will have. Is if you think about most organ donation, not all organ donation, but a lot of organ donation, in order to get that donation, somebody has to lose something. And sometimes that something is their life. And what's not uncommon is a little bit of survivor's guilt about, why did this person not survive and I did? And now, I'm blessed with this person's organs that are helping me live. And we don't always have those answers, but sometimes transplant recipients will have a little bit of guilt around that. And that's normal. That's natural. And that's something that you need to be kind of ready to talk about and talk through. They may have some anger. They may have some anger about having to follow a very regimented healthcare protocols. That may be something that is becomes an issue for the recipients and for the caregivers. They may have a little bit of grief. And most of the time, they're just going to be happy. They're just going to be happy that they've gotten that second chance, that they have this amazing gift of the organ that they've received. Is sometimes, it's overwhelming that what an incredible gift that is. And you feel incredibly, incredibly blessed. So both as a recipient and a caregiver. Now, as we kind of wrap up, one of the things I'll tell you is make sure, as a caregiver, as a recipient, make sure you're taking the time to celebrate the wins and the gift of time. The gift of time. For every year that you live with that transplanted organ, or that your loved ones living with that transplanted organ, that time's a gift that may or may not have come to fruition without that transplant. So don't forget to celebrate those milestones, those anniversaries. Those transplant anniversaries are an incredibly important thing to celebrate and enjoy. There's a quote from the former First Lady, Rosalind Carter, that says there are 4 kinds of people in this world: those that have been caregivers, those that are caregivers, those who will be caregivers, and those who will need caregivers. And oftentimes we can be more than one of those. So caregivers play an important role in this transplant journey. So for my caregivers there, keep in mind what a critical role you have and how important your role is to those precious transplant recipients that you love and care for. So there's a little thing I found here called the Caregiver Bill of Rights. I'll let you just kind of take a look at this. This is kind of a reminder that as a caregiver, you have the right to take care of yourself. It's not selfish to take care of yourself. That's going to give you the capacity to be a better caregiver. It's okay to seek help from others. And make sure that you own and honor your own limits. You can maintain facets of your own life that don't necessarily include the person that you're caring for. That's okay. It's not selfish to have a separate life. It's okay to be angry. It's okay to be depressed or express difficult feelings occasionally. Sometimes we all need that. and people that we can vent to if that's what we need to do. It's okay to reject any attempts by your relative, either consciously or unconsciously, to manipulate you through anger, guilt, or depression. And again, the recipients are going through this emotional roller coaster, and we as caregivers are going through that with them as well. It's okay to take pride in what you're accomplishing, and the help that you're giving your recipient, and what a great job that it is. It's okay to protect your individuality, and you have the right to have a life for yourself. And it's okay to expect and demand that new strides are made in finding resources to aid your transplant recipients and you as a caregiver. So I think this is just kind of an important reminders, is that you as a caregiver have an important role in this transplant journey too. And it's okay that you need care as well. With that, one of the things that I think is super duper important is having support for caregivers. I think is really, really critical. And if you don't know this already, the Pre to Post Foundation has that with their buddy program. With their buddy program, it can hook you up and connect you with somebody who's going through something similar, someone who is also a caregiver, so that if you don't have anyone else to talk to, you might have someone who's been down the journey, been down the road that you're getting ready to go down. I think the buddy program is probably one of the most important things the Pre to Post Transplant Foundation does. So if you need a buddy, if you need someone to talk to, someone to be there and go through the caregiver journey with you, this is a great option. It's 100% free and open to everybody in the transplant community. So it's hopefully you're signed up. If you're not signed up already, then just jump on the website and you can get signed up. And with that, I'm going to wrap this up. I'm going to give you guys a chance to ask any questions. If you have any questions, any discussion, we have a little bit of time for a brief discussion. And tell me, what do you think?